Hi everyone, I'm Dr. Cassidy.
Dr. Mariah.
And Miss Dr. Mariah here is 37 weeks pregnant. So she's gonna help us walk through this treatment video. She'll show you how she's safely gonna get to her back by coming to her side and then rolling onto her back. Of course, we use a wedge in here. That's how we stay propped up. So as pregnancy progresses, we're not worried about compressing those abdominal vessels. That is why we tell people that they can't lay flat when they're pregnant. We avoid that. We keep them here as long as they need to, as long as we need them to be here to get the work done. Wedge. And it's really cozy.
Yes.
And we're just gonna hop right into it because this month is month 8. We're talking mostly about that rib and diaphragm pain that your patients might be experiencing. Truthfully, that rib movement occurs way before that 8-month mark, so it might start earlier for some of your patients. The ribs have to move before uterus expands, so then we have room for baby to grow. Another key component with rib diaphragm is the acid reflux piece with the connection to the stomach. So we'll be chatting your ear off about all of those things like we do with our patients in here. To start, we're gonna work on lengthening through the diaphragm and the area of the diaphragm. We like to use BioFreeze in here only because it works to use BioFreeze and then tape. So that is really the only logic. It doesn't take much. Thank you, Mariah. And we'll do both sides. If we're talking heartburn, of course, I'm gonna be focused on the left, but you can do both, especially if someone's having pain that wraps from the back to the front, and you're gonna work with your patient's breath. So Mariah's gonna take a breath in. I'm gonna find the bottom of that sternum and drag my fingers out. Just following right along that rib cage. Awesome, and then the pressure is all gauged from mama, and you're gonna be surprised the amount of pressure you can really give them. This is one way to do this. You can also do it when they're on their side, so I'm gonna have you just pivot there. So she'll roll onto her side. The side that we're stretching will be up. This is lovely because you can get length through the entire side body and you can work towards the back. So Mariah's gonna extend that arm up, extend that leg back a touch. More BioFreeze, simply for tissue drag. It'll be nice and chilly after this. And then breath in and out. Again, sternum, following that rib cage, dragging down and out. This is nice because I can work back further. I can really follow that wrapped kind of rib pain that your pregnant patients are probably feeling. Diaphragm is also something we think about when we think about baby positioning, simply because a lot of babies get nice and cozy up in this rib area. Breath in and out one more time, just because we're here. Awesome. So don't forget to work the diaphragm, that lower rib cage, if you're working on baby positioning as well. After we lengthen, we like to tape. Tape does a few things. One, it increases blood flow, increases lymph flow. It also gently lifts up on the outermost layer of skin. The goal being to take some pressure off the pain receptors and stimulate your other mechanoreceptors, turn down that pain, turn up the comfort, you know. And we also recommend that patients tape their bellies at home because it's a really easy tool that is inexpensive and viable and maybe can get them a longer duration in between their appointments.
Right, and easy to use.
So easy. So I just taped her diaphragm. I could also apply another piece of tape and even wrap it to support that rib cage area. Just gonna feel really nice. Perfect. Putting all my goodies away. Come on up for me. We're gonna get Dr. Mariah into our pregnancy pillow next. We love our pregnancy pillow from Bellust. It's from the UK. It is the best one we have found. If you have a favorite, please share because we need more types of these amazing pillows in our life.
Yes, right. Share with your colleagues. Of course, table. Of course, we have that thoracic drop, which gives us even more room, which is wonderful.
Fabulous. Beautiful. All right. So from here, as far as assessment goes, you're feeling for muscle tension along the rib heads, especially. You can do that with your hypotheners. You can do it with your thumbs. Feel for the tension in the muscle, the elasticity, how tight is something holding. A posterior rib will cause muscle to spasm or hold. Very good. Poke around, assess motion. One way to mobilize this area is what in school we call an iliocostal lift. Here we're gonna call it belly rocking because that's a lot more fun. I'm gonna reach around to the front of Mariah's ilium. Starting at the very base of the rib cage, I'm going to push down on the rib cage and lift at the hip. and I'm gonna work my way up. Giving a slight little push, just gentle mobilizing up through that rib cage, getting those rib heads to flex and move like they should. And that is all we need for here, so I'll have you press on up.
And I can't tell you how great that small bit of relaxation feels, truthfully. So
Rotation,
keep that in mind.
yes. So, you know, that rib cage prevents a lot of rotation anyway when you're not pregnant. When you're pregnant, that rotation's limited even more. Your pregnant patients are gonna love you if you can help instill some of that motion into your
Right.
ribs.
And even after you get the movement, just that mobility alone can be enough to ease up some of the muscle tension to give them even more relief.
Yes. If that wasn't an option, or maybe it's something that wasn't super successful for Mariah, I could go ahead and put her on a thoracic board, do an anterior adjustment. I'm only gonna show you just how to get your pregnant patients down and up safely. We're not gonna go through the whole production. We're chiropractors. Hopefully you know how to do an anterior thoracic board here just to take away the squish. She'll come again to her side, roll to her back, beautiful. And then we'll give a hug,
Right.
adjust, beautiful. Now,
Done.
coming up, side, arms, so then we don't have to use the core. It's beautiful. Simple things go a long ways, especially when you are working with pregnant patients. We also instruct them that's how they should be getting up out of bed too, rather than a crunching motion. They'll thank you postpartum. They don't even know, but they will. And then let's go through some stretches. So the tools that you can give your patients, we have a lot more on our YouTube channel, so you should go check those out if you're looking for more, but these are just a handful of options that you can provide for your patients when they're dealing with this rib, diaphragm, heartburn type pain.
All the things, right.
All the things.
I especially think of eagle arm, your typical eagle arm stretch, especially when we're talking about that upper back, upper rib pain. I don't know, maybe I'll turn this way.
That's
actually.
beautiful, and I'll mirror it from the front. So typical eagle arm, our arms wrap here,
Elbows are up.
parallel, and then you can turn and drop towards that lower arm. Mariah's feeling it here, she's feeling it through here, and then she's gonna switch her arms so then we can tackle that other upper back spot. It's kind of in the zone of the levator scap, so it should feel really good and just add some expansion in the upper rib area.
Yeah, it's perfect.
Awesome. Let's do gold post. You can do this in a door frame. You can do it against a wall. Really anything. Biggest thing is that you want your arm in an L. We like our arm perpendicular to the ground, and then you can lean in, you can twist away, and get that stretch through the anterior pectoral muscle.
Right, to help open up that chest, right? Because everything we do in life is basically in front of us, so we get a lot of flexion, and we want more of that extension for the rib movement.
Absolutely. Speaking of extension, let's show them some thread the needle and some variations. So Dr. Mariah is going to stay here and practice some rotation. As belly grows, rotation can get even harder, like I said before. So kind of gives you some options for different points in pregnancy. I'm going to do a thread the needle. So I will be on all fours. I can reach my arm up, and then I can thread down. And Mariah is going to thread open side to side.
Side to side.
Yes.
Don't mind my Z-sit. That's not necessarily part of it. And as you can see, it almost even restricts my movement to my left. So if I come back here and stay center, or maybe I'm seated in a chair, my feet are on the ground, except this table is a little tall for me. I'm going to inhale up and then exhale and goalpost down.
I love that you added that. A lot of patients don't actually know that when you're stretching, you should be working with your breath just in the same way like when you're lifting. So we inhale and we exhale, and that's how we're going to get length in our muscles, oxygen to our muscles.
Right.
And it's just going to feel better for them. So help them out with that little tip. We're going to do cat-cow, a different variation. Again, I'll be on all fours. Mariah can stay seated. It's always good to have options, especially because sometimes women don't have the accessibility to get to the ground. Maybe they are also dealing with tailbone, low back pain. So cat-cow is beautiful. We're getting that flexion all through the thoracic rib cage. Let that head fall, and then you can also get that lovely extension through the spine. And again, working with your breath to really find that mobility, and letting your patients know that if they hear some cavitations at this point, it's totally safe and normal, and they should welcome them.
I will also
Free
say,
movement.
A lot of your patients are probably spending a lot of time at a desk, right? They may be. So if they're not willing to get down on the floor at work, then they have a seated option.
They have an option. Final thing that we will show you is using our favorite tool in the office, an exercise ball. So I'm gonna get it out for Dr. Murray here. First, let's get some extension. So to get extension on your ball and safely, start on your seat.
Right. Wide stance.
Yep.
I'm comfortable enough to roll down here.
She has something here to hold on to if she needs.
Goalpost or extend, right? Pending what your patient is feeling and needing. Regardless, there's extension of my spine here. Now to come up, this will look different for different people. It's great that I have this coffee table here. I personally am a huge fan of trying to roll to the side and come up, but you might want, if your patient is stable enough, to have them roll down and walk back up. Always a great idea to have somebody nearby just in case.
Like you said, the coffee table, the ottoman, something to help you get on and off, and truly not that big of a deal. The next one is the Pilates ball. This is a favorite for pretty much all mamas here in our clinic because it's brilliant postpartum too. Again, we're gonna put this ball in between our shoulder blades this time. It's gonna provide, yes, side, side,
I
side.
contact the ball and then I roll.
Beautiful.
And again, I can goalpost.
Yes. Women do tend to like this one a little bit more because the extension that you are extending over, that point is smaller, so you can pinpoint the tight spots a little easier.
Much better.
Yes.
And much more stable.
Yes. I was going to say comfier than a foam roller for me personally.
Yes. Yes.
So yes, roll to that side and come on up.
Awesome.
Beautiful. Thank you. And then we'll show you one more ball stretch. Miss Mariah will be on the ground and she's just gonna find length through her side body. We kind of give this side body stretch for numerous things because you can dig into different areas of your body. The way she's doing it here is going to lengthen through that side body, her diaphragm, her abs, even maybe a little bit of her round ligament. In the next video, we'll show you how a very similar stretch will actually target your tailbone. So, really cool that you can provide your patients with simple stretches that will cover a myriad of conditions that they are dealing with right now. The products we talked about for this month, the biggies are BioFreeze, tape, the ball,
Exercise and Pilates.
exercise and the Pilates ball, big and little, and then the wedge. The wedge, seriously, for practitioners, a wedge and a dowel is going to be an absolute must because if you want your pregnant patients to be on their back for any sort of extended period of time, you need a wedge. So, if you have any questions, leave them in the comments and you'll find all the product links in our description.